Thank you for joining me today as we give an update on our state's response to COVID-19. I'm here with Secretary of Health Jerome Lothridge, Secretary of Science Dr. Casey Schrum, Secretary of Commerce Sean Copeland, and Chad Warmington, the President of the Oklahoma State Chamber. Thank you so much for joining me today, guys. We're here today to explain how and when we will get Oklahoma back open. Let me be clear. We will do this safely, responsibly, and based on the data in our state. From the beginning, it has been my attempt to do two things. Number one, protect the health and lives of Oklahomans, especially our most vulnerable population. And number two, to mitigate the impacts to Oklahoma's economy and get Oklahomans safely back to work. You might have heard me say that what we do in the month of April will greatly determine how fast we get back to work in the future. The 15 executive orders that I signed starting back on March 15th were designed to protect our hospital capacity, flatten the curve, and secure more PPE. Oklahomans, you have done a fantastic job. We have flattened our curve, and we've developed a plan to increase the hospital surge capacity, and we have made tremendous progress on PPE. The White House guidelines have four main gates that we had to get through before we could start opening up our economy. I want to show you some graphs on how we're doing on each one of them. One of the gates is treating all patients without crisis care in our hospitals. Our total hospitalizations peaked at 560 back on March 30th and has continued to then trend down for the entire month of April. To be clear, the graph is tracking people in the hospital with confirmed COVID-19 or people in the hospital that are being treated for COVID-like symptoms. We currently have 298 people in hospitals for COVID across our state, but we have more than 15 times those amount of beds available across our state. Gate number two, as designed by the White House, is a downward trajectory of documented cases, and our new cases are continuing to decline. Daily reporting varies because of testing on the weekends, so we track these on a 7-day rolling average. You can see how these are trending down. These numbers are trending down even as we continue to test more and more people across our state. The White House also has two other gates. We are tracking them as well. Influenza-like illnesses and COVID-like syndromic cases are also in the downward trend. As I mentioned before, we will use data to make decisions on when and how to safely reopen responsibly. Our plan to open up and recover safely includes a significant focus on testing and tracing. We know that this virus will continue to be around for a long time. We are not out of the woods yet. This virus is still in the United States. It's still in Oklahoma. People will still come in contact with this virus. That is why social distancing and taking precautions like wearing a mask is still really important as we continue to take a measured approach. Enhanced testing and tracing allows us to better respond to people who get sick and quickly identify who needs to be isolated so we can control the spread of the virus. I want to be clear, when it comes to reopening our economy, protecting the health of Oklahomans remains my top priority. We have put together a group of industry professionals from across our state, and they have been working with my Governor's Solutions Task Force and our health advisors to develop a way to get back open safely. I'd like to invite Chad Warmington to give you an update on this process, as he's been our chairman of this committee. Chad?
Thank you, Governor. It was an honor to serve as the chair and continue to serve as the chair of this group. The governor gave us a very narrow focus at first. The narrow focus was get Oklahoma open safely, priority number one. Once we get Oklahoma open safely, we can start talking about restoration and restoring the economy, and that is obviously of big importance to the business community of Oklahoma. He identified some strong business leaders that we put on this across the state of Oklahoma, across the industry sectors. They asked a lot of good questions. They wanted to know right from the very beginning. Talk to us about the health metrics. Are we on pace for all those things, and how is the state measuring those outcomes? We were very satisfied with the answers that we got, and we were able to move on to now do we need to talk about phasing in the opening of the Oklahoma economy. And I think we're still ready now to really ready to move on to the restoration part once we get open for business. If you can't open safely, we can't get onto the restoration portion, and that is exactly what this group was focused on, and we're proud to serve the governor, and we're proud to continue to serve the governor and talk about the next phase, which will be restoration as well.
Thank you so much, Chad. Thanks for all your efforts and all of your other members on that committee. That's very, very helpful for all of us in the state of Oklahoma. Like the White House guidelines, Oklahoma's plan to open up and recover safely has 3 phases. We will not move to the next phase until the data tells us that it's safe to do so. I want Oklahomans to know that even as things begin to open, it is so important that we continue to practice social distancing. Keep washing your hands, stay at home if you're feeling sick. This is a careful and measured approach designed to protect our most vulnerable while safely easing Oklahomans back to work. With that being said, let's talk about phase 1. Based on the data, Oklahoma should continue to follow safer at home guidelines if they are 65 or part of a vulnerable population. Continue to maximize our physical distance from others while in public. Avoid social gatherings in groups or facilities that do not readily allow for appropriate physical distancing, and minimize non-essential travel. Based on the data, employers should create plans to allow employees to return to work in phases. Common areas like break rooms should remain closed when possible. It's also important businesses honor requests of employees who are part of that vulnerable population for special accommodations. Starting on Friday, personal care businesses can reopen for appointments only if they adhere to strict sanitation protocols and are in communities that do not have more restrictions in place. This includes hair salons, barbershops, spas, nail salons, and pet groomers. These businesses must maintain distance between customers and encourage customers to wait in their car until it's time for their appointment to avoid congestion in the lobbies or their entrances. Grocery stores should continue to maintain special hours to our most vulnerable populations. They have done a great job, and it's so important that they keep those special hours for our most vulnerable, our elderly populations. Starting on May 1st, the following businesses can open statewide if they adhere to strict social distancing and sanitation protocols. Restaurants, dining rooms, movie theaters, and sporting venues and gyms. Places of worship can reopen for in-person meetings or worship, provided that staff and volunteers wear masks when interacting with the public. They abstain from serving food or coffee, sanitize between services, and keep their nursery areas closed. During phase 1, bars need to remain closed. More specific guidance will be available on the Department of Commerce website. This is important. If our hospital and our incident rates remain manageable for 14 days, we will then move to phase 2, but only if our data tells us it's time. Phase 2, elderly and vulnerable Oklahomans should still follow safer at home guidelines. Non-essential travel can start resuming. Employers should still close common areas and gathering places. Phase 2 allows for organized sports activities to reopen under social distancing and sanitation protocols. Bars can operate with diminished standing room occupancy with social distancing and sanitation. Funerals and weddings can resume with more than 10 people. Children's areas and nurseries and places of worship can reopen. In Phase 3, if our hospitals and incident rates also continue to remain manageable for another 14 days, then we'll move into Phase 3. We will provide more detailed guidance of Phase 3 when we are into Phase 2. Again, we are making decisions for Oklahomans that are based on the data in our state and to protect the health of Oklahomans. I've been on the calls with Dr. Fauci from the White House Task Force, and he has talked about how reopening will not be like flipping a light switch on and going back to normal. Our plan is a measured approach, and we will continue to watch the data each day, and we'll pull back if we need to. Let me be clear. We need to continue to practice social distancing and keep doing our part. Wear a mask if you're in public. We will continue to watch the data every day, and we will pull back if we see our cases spike or our hospitalizations increase. There is light at the end of the tunnel, and it's starting to get brighter every single day as we do more testing and we continue to watch those curves flatten. So thank you, Oklahoma, for taking this seriously and doing your part to get it to this point. God bless you, and God bless the great state of Oklahoma. And we'll open it up for a few questions.
Who's going to enforce the social distancing? I imagine you're not going to let salt pews in half the churches and, space restaurants out. But who's going to enforce that once you open all these things?
So just like it's been today, these are guidelines for our communities, and our businesses have been doing a fantastic job of adhering to these guidelines. Most churches, as you know, are going to been online, and these are guidelines. I have no doubt that our churches are going to adhere to this and are going to follow these guidelines as they safely reopen after May 1st.
Governor, what have your conversations been like with the mayors of Oklahoma City? Do you feel like you guys are on the same page with the phased reopening approach?
We really do, yes. I've been on the call with Mayor Bynum, Mayor Holt, and we've done some calls with the municipal organization and all the mayors across the state. Again, for those communities that don't have more restrictive guidance, like I said, we're encouraging some of those barbershop nail salons by appointment only, that they can open on Friday. For the communities that have some more restrictive guidelines in place, then that will have to wait until May 1st. But I'm giving guidance for all 4 million Oklahomans, for the folks in Lawton and Guyman and Bartlesville and McAllister, just like we are for Tulsa and Oklahoma City.
I'm sorry, real quick to clarify, are you saying that come May 1st, the state order will supersede the municipal orders, or do municipalities still have the authority to make their own orders after?
Well, we think that most of the mayors will line up with our orders on May 1st, and we'll cross that bridge when it on May 1st if we're seeing some more restrictions. But right now, we're going to let some municipalities make some decisions before May 1st, and then after May 1st, it's our intent to really move to Phase 1 all across the state. We think we have pretty much broad buy-in, and the data really confirms that, because the whole goal of this was to protect our hospital capacity, was to get prepared for the surge, was to flatten that curve. And Oklahomans, we have done a fantastic job with that. And so the data says that we can do a measured roll-in now at this point.
Governor, the White House reported that we're one of 4 states that has the lowest testing in the United States. Can you tell me how many tests we're able to run each day, and if you think we're going to ramp up that testing more in the coming days?
Sure. I'm going to ask Dr. Shrum to update on the testing. Dr. Shrum.
Yes, so I am aware of the report from the White House, and we are in communication with the White House and some clarifying some communication. When you look at maximum capacity for the state and what we've put in place, and of course we're struggling with supply chain just like everyone else across the state, but our maximum capacity within the state for PCR testing daily is about 13,500 roughly, and then and that's around 48-hour turnaround time. Now that always depends on reagent. And then our capacity through our contracted labs, which turnaround is between 2 to 5 days, would be about 33,000 tests. So if you look at what we started out in mid-March, we were testing in the hundreds. Today we've tested over 45,000. So we're expanding that very quickly. We've stood up 80 swab sites, and we still have not exceeded our capacity to turn those around within our labs. So we are feeling very good. We are clarifying the data that was sent in the way that it was interpreted through the White House to clarify those numbers.
So are you saying the White House has rated us incorrectly?
No, I'm saying the report that you're referring to, we're having conversations with them and clarifying based on the platforms that were reported. Every platform has different capabilities, and so we need to make sure that they actually have the right numbers with the correct platforms of the various testing capabilities within the state.
Dr. Trump, have any of the clinical tests that's going on shown more promise than others? Do you have any kind of guidance as to how those things are going?
Yeah, so I do, we feel very strongly about the PCR testing, which is the test that actually is looking for genomic material through the nasopharyngeal swabs. A lot of different things around antibody testing. The one thing that we recognize and that everyone is having challenges with is that we need testing capabilities, and so those tests are rolling out very quickly. Those tests, antibody testing is great for surveillance. Until we get more information, they are not diagnostic, they don't determine immunity, but we do know that people who have antibodies have a decreased risk. So there are a lot of different lab platforms out there, from point of care testing, antibody testing, to the actual serum testing, and there's some variation, and so
Trial and error?
No, I think we just don't fully understand. We don't have, we haven't had enough time to follow those to say this is how long immunity lasts when you have antibodies. There's some cross-reactivity with, other coronaviruses that we don't have enough information to. But what it can tell us is that what the prevalence is for sure. I mean, when somebody has antibodies to the coronavirus, we know that they have been exposed. So it is good for surveillance and again, just letting us know what's going on in the community, and particularly with asymptomatic cases.
Doctor, in terms of fatalities, what's the protocol for testing those individuals, and how do we know if they died of COVID as opposed to dying of another ailment?
Right.
For example, I know in New York they had 3,700 deaths over the weekend. They labeled all those as COVID related with no testing.
Yes. So those that obviously are hospitalized or known cases, we're really looking at what are the underlying comorbidities. If there are some questions, in those cases are going for autopsy or going through the medical examiner's office, they can do swabs and freeze those for 5 days. I think right now, obviously when you look at New York, their prevalence rate is a lot higher than ours. We have put that into our plan of educating. The medical examiner's office has been in close contact and doing educational with our funeral homes across the state to help people understand what that may look like in the future. But currently we aren't testing every single person who expires outside of the hospital and assuming that it's COVID. We're looking at those on an individual basis of what their comorbidities might be and the concomitant diseases that they have.
There's the hair salons and doing nails. How do you do that safely? Customers are still concerned about that.
Right, so the guidelines that are being set up, we're asking people to wear masks, both customers and those who are providing the services, and adhering to certain guidelines as far as disinfecting areas for work. And I think someone else might be able to speak specifically to those guidelines if that's what you're asking. Okay, yes.
To answer your question, we went through, we're using the CDC guidelines as a minimum, and then in addition to masks, disinfecting the areas after each client that they see, taking their temperature just to make sure. So we're adding, in many instances, on top of what the CDC is requiring.
So will it be mandatory to wear a mask to these places?
What I would encourage everyone to do is look at the guidance for each individual industry. So it's going to depend upon, we're working with each industry association. We're looking for best practices for each one. For a hair salon, certainly it would, because you're right there together. So if you can't practice social distancing and maintain at least 6 feet apart, then we were encouraging masks to be worn.
Could I ask you a real quick question? The legislature has about 5 weeks left to deal with the budget, deal with some other policy priority bills that deal with COVID. As May 1st rolls around and things open up across the state, do you have advice on whether the public should be allowed back into the Capitol to be able to interact and observe and advocate for things on behalf of their representatives?
We will, when May 1st rolls around, we're going to open up, obviously, the restaurants in a certain manner. I'll get with the legislature to find out if we think it's appropriate to have to open the Capitol back up. If we have social distancing, people feel comfortable coming in, and maybe that's a possibility. I know at this point it's closed down to the public, but when the legislature gets back in here, that's a definite possibility.
Yeah, I think a lot of people might have thoughts on that. Mr. Warmington, would you have any comment on, you represent a lot of businesses, you have lobbyists on your team, you track legislation. Do you have concerns about the idea that the legislature could come in May when it's notorious that things appear at the last minute anyway? Do you have concerns if the public isn't allowed in here to watch what they do?
No, I don't think so. I think the business community and lobbyists in general, folks that spend their time up here at the Capitol, are doing just what businesses are doing all over the state. They're able to communicate with their legislators or staff just like we are through Teams meetings, Zoom meetings, and whatnot. The ability to communicate is still there. You don't necessarily have to be in the building to communicate those ideas and principles. And I think that's part of what this group is going to do for the governor as well, is we're taking that feedback on the things that we need to do when we move into the restoration phase, and I think we'll be able to be helpful in communicating those messages to the governor and his team. So I don't think it's going to be a problem at all. Again, they'll make the right decision based on what the capacity of this building is and what's safe for the legislature. But I think Oklahomans in general will be able to communicate very easily with their legislative leaders.
But from a civic conceptual perception, we can go to the movie theaters, but we can't go to the Capitol.
Yeah, I do. I understand the perception, but I also think we got to put, as the governor said, the health and safety of Oklahomans first, and that goes for the legislature as well. And again, if there wasn't a way to communicate with legislative leaders and staff and the governor, then that would be a problem. But I think we all know there is the ability to do that, and I think those lines of communication have been very open, and I think that's part of why the governor engaged us, that our businesses, leaders from across the state, if you look at the industry sectors that are represented, it's pretty comprehensive. They're going to be able to give feedback to legislative leaders, the governor, and the secretaries to make sure that those opinions and those needs are being met. I'm not concerned about it at all.
Governor, people have expressed concerns about non-emergent dental care opening up too soon. Obviously, they're right in your face as the nature of their work. Do you believe they should be opening up this early, or should there be an extended period for non-emergent dental care?
I'm going to let because we rolled those out in a red, yellow, green phase on the non-elective surgery. So I'll let Dr. Schrum answer that.
Yes. So on the elective procedures, and the way that is actually stated is that if they have the ability to have appropriate protective equipment, and that they want to go ahead and open that up, that it is available for them to open those procedures. And each one of those offices and clinics obviously, can visit with the dentist that they're working with and have those conversations in their clinics individually.
Governor, he says that during the phase reopen that if the trend reversed in any way and we pull back, can you define what that looks like? What data would you look at to qualify it?
Yes, so I've got the Secretary of Health here to answer kind of the trends we'll be monitoring.
Yes, thank you. There's really, we look at a whole multitude of data points really on a daily basis, but there's two that are dispositive relative to our advice on the governor's behalf as to phases. They are one, when the influenza-like illnesses start to trend downward, and then two, where our hospitalizations are. And so really when we look at those two data sets, it's very simple for us to be able to see the trend of a line. Now that won't necessarily tell us exactly what we should advise the governor, but those are two data points that we're looking at. Again, it's hospitalizations, and I said influenza-like, it's incident rate. So incident rate and hospitalizations are the two things that we'll be advising the governor on. Again, we look at those with respect to the curvature of the line, and insofar as those are remaining what we say at a manageable level, and there we just bear statistics in mind. If they're at a manageable level, then we'll proceed to the next 2-week period. If not, then the governor will have that information in his hand and can make the policy decision.
So just to clarify, so even if it's trending up, but you still feel like it's manageable given the state's resources, that wouldn't necessarily result in a revoting or
right. The reason that question was, even if it's trending upward to some extent, does that automatically mean that we would curtail the next activity? Again, we've stipulated that it's a manageable level, and that you can think, I think, in terms of our surge capacity as an example. It was never the case that if we hit a specific number, it was always the case that if we had what we thought to be a number that we could manage, it's in that respect that we think about this. I think that's a similar mindset into how we advise the governor here.
There was talk about sending the National Guard into nursing homes if it got out of hand. Are you still considering that? I mean, these are some hot spots across the state in these nursing homes.
Yeah, I authorized the National Guard to go in and do a deep cleaning throughout all of our nursing homes. We also have 11 TAC teams that are going in to do a testing, tracing, antibody cases. And my directive was I want all 17,000 patient or nursing home folks tested across our state for the antibody and for the positive test, so we can trace, we can isolate. But the National Guard is involved with our nursing homes, our long-term care facilities.
A lot has changed in a week, and I want to ask you about this, even though we addressed it last week. Now that you have a clearer picture of the budget, are you going to rethink the $40 million we're getting from the Department of Education? Do you still think you can go to those two programs you mentioned, or are we going to put that in the general fund, the drop-off education we have now? How are you approaching that $40 million now?
So nothing's changed on the $40 million. The $40 million was given to the executive branch to benefit the education in the state of Oklahoma, and that's exactly how those funds will be dispersed.
Just wanted to be clear, the city of Norman has had some, let's say, more strict regulations during parts of this whole situation. So if after May 1 they were to maintain stricter regulations than what the state is imposing, would you go in and say, no, you can't do this? Or would the state regulations supersede what, say, Norman would try to do?
It is my intent, based on this data. So you got to remember this. We put all of this, all of the executive orders in place. Everything that we've done is to flatten this curve. Everything we've done is not only flatten the curve, but also to prepare for the surge in the hospitalizations, to get ready for PPE, to protect our health workers. We have gone from 560, we peaked in hospitalizations. This is really important for Oklahomans to know. We had 560 people in hospitals on March 30th, and we've had a nice slow decline since then. Today we have 298 across our state. We have 4,600 hospital beds available in our state. And so the whole idea was to flatten that curve. Oklahoma's done a great job. So there's always going to be critics on when you could open up and should you delay further. So that's why it's about a measured approach and watching that data. And so it's my intent as governor is to give guidance across the state to every citizen, to every municipality. And we'll deal with that on May 1st when it comes. If there's still certain things, if we're still seeing the data where it is today, then we'll make that decision, and I'll be on the phone, and we'll be able to handle that, I'm sure, with any mayors, and the mayors have a tough job too, and that's why we want to give everybody guidance up until May 1st. But at that point, we really want to move into phase 1.
Thank you, everybody.
Thank you.